today I'm interviewing Dr. Tamika Adams. She is a chiropractor in Cartersville, Georgia. And hi, Dr. Adams, how you doing?
I'm great. Thank you for asking. How are you?
Good, good. So can you tell us a little bit more about what you do every day and just about your work?
Okay, well, I am a chiropractor and I adjust people. Not only, I try to think of myself as an adjuster, not just adjusting subluxations, and those are the misalignments of the spine that put pressure on the nerves, but also adjust being able to help with one's life when they come in. I like to talk to my patients, and sometimes we get on deep conversations about what's going on with them, and in different ways I can help them in other ways besides just their health too. So I love doing what I do because I can help them physically. Then also I like to think of myself helping their overall being, their overall um, health and wellness.
Oh, how did you get into chiropractic?
Um, well, you know what? I when I was ever since I was a child, I had a dream of either being an actress or a doctor. So I've always
Mm.
had wanted to go into the medical field in some way, or be an actress, which was totally two different things. So I did undergrad and I did it in pre-med and theater when I did my undergrad. And then I I was actually trying to get into the acting, get into the film, and I never made it out to California. I used to tell everybody, "Oh, I'm going to go out to California. I'm going to be this big actress and be in the films." And then since I never actually made it to California, I was looking into, and I wasn't sure if I really wanted to go the MCAT way, the medical doctor way. And my grandmother, she was actually a chiropractor.
Mm.
And she was the first African American female doctor in where I grew up at Toledo, Ohio. And she actually still holds the record of being the first African American female chiropractor
Oh, wow.
in Toledo. She was also the first African American female um, a doctor to be able to pass the Ohio State medical boards. Because at
Wow.
that time, chiropractors had to pass the medical boards. There wasn't a separate board, chiropractic and medical board, like there is now.
Wow.
So I wasn't originally thinking about going into chiropractic. I was originally thinking about going into the medical field, but then I happened to, it's kind of a strange story. I mean, even though I had my grandmother as an example, um, I was at a restaurant. I was serving at the time because I was in school, and I was at a restaurant, and I ran across two people that came from Life University, which Life is a school in Marietta, Georgia. And we started talking about chiropractic and the philosophy of chiropractic, which is about how the body heals itself, and not using the use of drugs and surgery. And I fell in love with that philosophy, about the body healing itself, not having to use drugs or surgery. And that is actually what, like, I think it was like 9 months later, I moved to Marietta, Georgia, and I went to school at Life University, and that's what brought me here
That's
to
your
be a
dream. Wow. Wow. So what would
It's
you
kind of a
say?
crazy story that kind of brought me this route. Like I was originally I was thinking anesthesiology, I was thinking of
Yeah.
more medically based, but
Wow. The journey of life. So what would you say is your favorite part about working in chiropractic?
helping others. That's the main reason why I wanted to become a doctor to begin with, is helping others. And I love, and it's so rewarding to be able to help someone without the use of drugs and medication. Like that's huge,
Mm.
especially now with people so um, on so many medications. And not only that, the third leading cause of death in the US is side effects to properly prescribed medication.
Mm.
So nowadays, most people are trying to get off medications. They don't want to go into surgeries.
Mhm.
And so being able to see and help somebody, when somebody that thought that they were going to have surgery and then realize they didn't need surgery, or that they're able to reduce medication or get off completely, is amazing.
Wow. So what would you say then is the worst part about working in chiropractic?
The worst part, I would say, would be some people just still don't get it. And it would be as far
Mm.
as the educational part. As a chiropractor, education of chiropractic is so important to each patient because it's a different way of thinking. Um, we grow up in a society that's so medically minded, and when you're told when you have a disease or a symptom, then you go see a medical doctor and you get such and such a prescription. That's how we're brought up, and that's what we think, right? But chiropractic is such a whole different way of thinking. It's about the body healing itself, and it's really medication, surgery. That should all be the last resort, but in most cases, it becomes the first resort for most people. And so some people, it's hard to break that thinking into them, or they don't understand chiropractic, or they don't understand exactly what, and there's a lot of misconceptions about it. So it's having to break through all that to get the person to understand why spinal hygiene is so important. We, take care of our eyes and our teeth, right? But we neglect our spine. And the spine is all a part of our nervous system. It's how your body functions. And if we aren't taking care of that, then you will see as you get older, your health will decline.
Wow. I think that's the most thorough explanation I've heard of the purpose of chiropractic. That's crazy. So when it comes to patients, which age demographic would you say you struggle most with connecting with? Like, is it the older folks? Is it millennials? Is it the baby boomers?
I wouldn't say I have a hard time connecting with a certain age group. I feel like I can connect to each age group, and I have each type of age group in my practice. I address infants all the way up to the elderly. I will say that with children, they do get it. You tell them, hey, I'm going to adjust your spine, move this bone because it's not in its right place, take it off the nerve, and it'll help you work better. They understand that. It's easy for them to get it. They're like, okay, cool. But as you work with the dogs, there's some people that can accept that, but then there's other people that are more skeptics. And like again, how we brought up and what our background is as far as health and what we view health is. So you have that at different age groups too, and then you have some elderly or the baby boomers. They may be more set in their ways. As well. And so each age group, like I said, I feel like I can relate to each age group or age demographic. I don't really have a problem with a certain one, but you do have, in those age groups, you do have skeptics or people you have to do a little bit more breaking through. But even skeptics, some of those are my best patients because they were skeptical, right? And then when they gave it a try, then they were like, oh my goodness, this really does work. And they refer, and they can become your best patients. It can be the hardest ones at first, though.
Wow, that's interesting. So as far as so businesses usually struggle in just 4 areas. It's either money, time, people, or passion. So which would you say you found to be the biggest struggle in chiropractic?
I would say actually money, and that kind of goes with what I was just referring to as far as getting people to get the big picture. Because with chiropractic, a lot of insurance may not cover chiropractic the way it should.
Really?
And I think there's a lot of people out there that don't really understand insurance and what goes with insurance. And so a lot of times we'll have people come in and they think that they don't have to pay anything because they assume their insurance would pay it all, or they don't want to go to provider, they have to pay out of pocket. However, if they understand about insurance, there's deductibles. Most of these deductibles are very high. And so the insurance isn't even going to pay until after that deductible is paid. And so there is a lot of out of pocket that comes with seeing a chiropractor. And like if the person doesn't want to have to pay, then they'll go somewhere where they think their insurance will cover it, can cover it better. But even with insurance and even accepting insurance, some insurance, there's no guarantee that they will pay. So it's about breaking through that wall and having people be educated about what chiropractic is supposed to do and how it can help them and what the value of chiropractic is, so that they will feel it's valuable enough to pay out of pocket.
Okay. So as far as shifting to your outside of work life, how would your family and friends describe you?
Well, there is, as a go-getter, very determined and motivated. I've always been that way. As you see, like ever since I was a kid, I said I was either going to be an actress or a doctor, and I actually did both. Um,
Oh.
so, and I still every now and then keep my eye on the lookout for any type of play or anything that I could.
Oh, wow.
So, like, I still, but like I did plays and theaters all throughout my life, and then also in commercials, and so I'm outgoing. I I dance. I ballroom dance.
Oh, wow, that's so cool.
Pretty much anything I set my mind to, I end up accomplishing, which I'm very proud of. Um, I'm a compassionate person and spiritual too as well.
And spiritual. Wow. So what gets you out of bed in the morning? Like, what are you most passionate about? I guess. Like, what wakes you up?
I'm very I'm passionate in what I'm doing, um, and I and what gets me up in the morning is just being able to help that one person.
Mhm.
I don't know if you've ever had that experience where you help someone and then you can see the look on their face, or when they're like, "Man, I don't have to take." Just yesterday, actually, I had a dinner with the doc
Mhm.
with my patients and some of their guests, and I had a testimonial of a patient who was saying that he doesn't take pain meds anymore, and he's been dealing with pain for years, and he doesn't have to take pain meds. And so he stopped taking those, and that the problems that he's been in car accidents, and the problems that he's was having from that have all improved. He feels that he's breathing better. His posture is better. So you can see all these different changes, not just with musculoskeletal problems, but like breathing, right? I have
Mhm.
another patient who's 9 years old. He hasn't had to use his inhaler since he's been coming. His allergies have improved tremendously since he's been coming. He hasn't had any problem with allergies. Kids and infants,
Allergies.
mhm, they respond so
Wow.
much better because their healing process is a lot faster. But like I said, chiropractic isn't just about musculoskeletal issues. It's dealing with the nervous system, and if your nervous system controls everything, if you have no interference with bones being misaligned, putting pressure on the nerves, then you're able to function. And so you can see how your body improves just because now there's no interference there. I always say I I remove the interference and let God do the rest of the work, right? Because your body's
Mm.
still. So if there's no
Yes.
interference, then your body can't function.
Mm. That's so. I before the series, I never really knew. Like, I mean, I guess I'm kind of like everyone else. I never really knew chiropractic was so holistic in a way. Wow. So what would you say then is your long-term goal? Like, you're successful. You followed your grandmother's footsteps.
Yeah.
You've done all this. So what would you say is your long-term goal?
Well, me and the other chiropractors I work with, our goal is to really set chiropractic apart, really educate our community, and spread our chiropractic philosophy around the world.
Do you specialize in a specific area? Like, is there a specific type of injury or situation that you prefer to treat? Like, that's your favorite?
No, it's none I prefer. I welcome all patients, all different types of patients, wellness as well as personal injury. We do specialize in personal injury. We do handle a lot of personal injury, but we also handle a lot of wellness. People that are either in pain or not in pain. Because, like I said,
Hmm.
um, chiropractic is not only about just pain, but it's about just having you function better. So I welcome all types of patients.
How can viewers learn more about you? How can they find you on social media or online?
Well, they can always go to our website, www.chiropracticinjuryclinics with an S.com,
Okay.
or call the office.
Or call the, yeah,
Always have to
everyone
go
call the
call the office.
office. Awesome, awesome. Well, thank you so much for taking the time with me today. And I really appreciate it. And I can't wait to share this with
Oh, great. Thank you. Thank you for having me.
everyone.